Cầm ngay đây nha. Vẫn ngay đây là cắt luôn.
Tuberculosis,
Yes.
maybe get a tuberculosis in the joint.
We should worry about this, right?
Yeah.
So a lot of what we see on these trips, particularly in Southeast Asia, is a large prevalence of something called avascular necrosis. And what that means is that the bone in the hip dies. It lacks nourishment or blood supply, and the most common reason for it is excessive alcohol use. And as you know, if you do drink a lot, it can cause other medical problems, which can in turn make someone a poor candidate for a hip replacement in general, simply from a medical perspective. So those are some of the challenges that we're trying to deal through. So are they healthy enough to have surgery? And is their bone healthy enough as well, independently, to have surgery? So there's a lot of patients here who have come to the hospital for the first time, who've had no medical care whatsoever. And in those patients, we have to decide whether their medical issues might stop them from being able to have surgery prior to them being addressed. And there's only so much we can do in the few days that we're here.
So some of the conditions that we screen for that would preclude or delay the initiation of the operation include high blood pressure, hypertension, or diabetes. And some of the patients have these diagnoses but are not being treated for them. So our job as part of the screening is to flag those diagnoses and determine if this is something that we can correct within the next few days to proceed with the operation if they qualify. So far this has been a very busy morning. So we've completed predominantly all of the screening process for the surgeries that we are planning on completing during this trip.
Good. All right, can you open his mouth for your biggest can?
Are they both equal in pain?
Hai cái trường án mình nó có đau giống nhau không hay là một bên đau nhiều hay ít? Đau giống nhau luôn.
We're only going to do a few patients, both sides, but his arthritis or his avascular necrosis is so bad. If we do one side alone, he'll get some benefit, but not as much benefit if we just do both of them, right?
Chân phải nó ok lắm thì làm luôn cái chân trái luôn. Còn nếu mà không được thì thôi làm một chân. Rồi chân kia để nó lành lặn hết rồi mai mốt mình làm sao?
This is a bilateral because if we do one, it's not going to do anything. And he is ready.
So he's some
Yeah. And then
In the room at 11:34 and start hang out with 57.